At ACMC, we believe people make the difference, and personalized, compassionate care is the hallmark of our caregivers. We have more than 65 ACMC and Cleveland Clinic family medicine and other specialists who see patients throughout Ashtabula County. Take a few minutes and learn more about one of our providers.
Hi, I'm Dr. Sampurna Shakya. Everyone knows me by Dr. Sam. I come from a very humble background where I trained back in Nepal. That's my country where I was born and then raised. It's a Himalayan kingdom. If you have not heard of Nepal, Mount Everest is there in Nepal. I did my medical school back in Nepal in Manipal College, and after that I worked for 4 years as a family physician. They're working in the remote hospitals. I used to look at all the patients from different age groups, so from pediatric population to the adult and to the geriatric population also, with wide variety of cases. And that is something that I'm really proud of if I look back into my career. And after that, back in 2017, I decided to get further, pursue further education and get the best possible training in pediatrics, because during my 4 years of practice, I developed this fondness towards specialty of pediatrics. So I started preparing for United States. I had to go through a couple of exams, and after that I matched in Cleveland Clinic. That's where I did my general pediatrics residency, and I finished back in 2020. Completed my residency, and here I am working in Ashtabula County Medical Center and enjoying my work here. As all general pediatrician, I treat a variety of cases based on pediatric population. So as we say in medical field, the doctors need to be aware of primary prevention, secondary prevention, and tertiary prevention. So primary prevention is preventing the disease to happen. So this is something that we do often in our clinic, like your well child visit or physicals, sport physicals, they are all primary prevention. Basically at that appointment, we're going through your dietary habits, like what you're eating, how you're growing in terms of your height, weight. We also discuss about, if it's adults, like the teenagers, we discuss about the puberty, see if they're growing appropriately as per their age or not, because if they are not, then that is something that needs to be looked at. That is our primary prevention. At that time, we also talk about the social issues. I think that is one of the most important thing in being a general pediatrician. The kids, they're not only coming there for their health issues. There is a social issue also all the kids go through. It might be at home setting or it might be at the school. So as a pediatrician, you have to go through, develop that rapport with the family as well as the patient itself, and try to navigate them through their social issues. So that is one thing. So another one is secondary prevention. So I treat lots of varieties of conditions when they have, let's say, respiratory issues like asthma, bronchitis, pneumonia, or upper respiratory tract symptoms, which are pretty common in toddlers and small kids, and actually all the patient population actually. Not only that, but urinary tract infections, ADHD, autism, those kind of cases that we go through all the questionnaires and try to see if they meet all the criteria or not. So that's our secondary prevention. So wide variety of cases. Tertiary would be if somebody has gone through a long hospitalization in some hospitals. They have to go through rehabilitation process through the physical therapy, occupational therapy. So we try to navigate that as well, try to make it possible for our families and our patients. We try to simplify that and then set them up with the appropriate resource. So basically, I take really good pride on my practice of general pediatrics. You basically deal with all different varieties of cases.
You can learn more about the provider you just saw or any of our providers by visiting www.acmchealth.org. If you want to schedule an appointment with one of our providers, please call 440-997-6969.